David, that is one ugly sweater, and it is not Ugly Sweater Day.
John, it's not half as ugly as the judge in Texas who tried to steal healthcare just in time for Christmas.
It's just as ugly.
Welcome to CareTalk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, we've come to the end of 2018.
Yes, we have.
And it's time for our year in review. So let's cover some of the most important healthcare themes of the year. Let's start with A, for Amazon. What did they do this year?
Well, I think a lot of the noise and energy was tied up with the Amazon, JP Morgan, till go on to becoming the CEO, this really idea of Jamie Dimon and Warren Buffett and Jeff Bezos. That's not the story. The story is Amazon, 100 million Prime users, 40 million Alexas, and they're starting to creep into healthcare by buying PillPack and getting into drug distribution and thinking about clinical protocols and data. The noise and the drama are around the individuals. The reality on the ground is actually pretty amazing. Because you take that footprint of 100 million Prime members, 40 million Alexas, they are already wiring a healthcare system from the home. It's really actually pretty impressive.
You know, John, the thing is, any industry, people are afraid of Amazon and what's going to happen, and they should be. But healthcare particularly so, because people in healthcare know just how inefficient and just how poor the service is in healthcare, and they're afraid of Amazon, and rightly so. You know, John, one of the things that people may not know about in that Prime group, you've actually got discounted Prime memberships for people that have electronic benefit cards, whether they're on Medicaid or food stamps. They get discounted Amazon Prime. They're being served in the home. They're treated as a solid customer, and the healthcare industrial complex, as you like to call it, should be scared, and they are.
Well, what's interesting is that all of the noise is around the individuals, but the healthcare industrial complex, parts of it are going to be replaced by Amazon. I mean, they already are building the highway to the home, and we at CareCentrix obviously are pitching, care to the home, and our mission is to help people age and heal in the home. We're going to have to deal with Jeff, and we're going to have to deal with Amazon because they're already there. One of our first forays was to tie the Alexa app to our care managers, and it's been super popular. I think what you're going to see is that more and more folks in healthcare are going to have to depend on an electronic superhighway that Amazon's already built and probably pay a toll for being on it.
A toll or a tool? So, John, what I found is, with the supplies business, so many people are scared of Amazon out there that they understand that the market for the adult diapers has gone way up. Moving right along. Now, John, in terms of drug pricing, you always love to talk about that.
Well, it's one of the most ridiculous things.
Anything happen or just talk in 2018?
Well, what's interesting, it's the battle of the bullies. We've got the bullies of pharma, this relentlessly raising prices. 80% of all of the best-selling drugs in America just extend their patents so they can keep their monopoly and jack up their prices on a regular basis. It makes absolutely no sense that Americans pay more than the rest of the world. They have been met in a bit of a shoving match by the president, the bully and the bully pulpit in chief, pushing back on what he sees as foreign freeloaders, but really unfair pricing. It remains to be seen whether that shoving match is going to actually turn into any movement. There was some pullback on the part of folks like Pfizer, who just repriced their drugs up every and then said they wouldn't, and now they said they are. It's unclear whether the president's going to stay focused on it, but my bet is he will.
John, I think it's kind of like the classic...
Your buddy Trump is right.
My man. But I think it's a classic kind of 1-2 punch or tag team, right? So Trump comes in there, bloodies them up a little bit, and then you've got more the geeks like Alex Azar coming in with actual real...
super geek.
Super geek.
Really
Does he have the pocket protector? So you got that coming in, and it's sort of as long as the pressure stays on, I think it'll be there. And this is an issue that affects almost everybody. People have an opinion about it if they don't understand it.
One out of 4 Americans cannot afford their drugs today in the country that invented these drugs and has a system to pay for them. It's insane.
Well, I think people are literally dying because they're rationing their insulin. So this is an issue that I think has come up. There hasn't been that much forward progress on it in 2018, but I agree with you, much as I hesitate to say that. In 2019, I think we're going to see a continuation, especially with the House in Democratic hands. We may see drug pricing continue along as a real issue.
So what about those midterms? That was pretty interesting results, David.
Well, John, I had
What
to
are
make
the implications for healthcare?
Well, it took me a little while because I had to go and make sure I had proper ID so that I could vote. Did you vote, John?
I
Did they let
vote.
you in there?
I did vote. Connecticut's a voter-friendly state.
Very good. Massachusetts as well. So, they flipped the House, and it was more dramatic even than expected. And I think what it showed is actually healthcare mattered. People voted for the Democrats because they thought they would protect healthcare, and they voted in favor of Medicaid
But don't you think
expansion.
it's more than a D or an R issue? I think Americans have been educated by the Republicans who fought the ACA about how important coverage, fair coverage, and access to care is. I don't think that's going away. And I think it's turning into much more of a purple or actually an American issue of getting access to coverage people can afford, maintaining a mix of public and private, and really focusing on expanding coverage and making sure the right care is affordable for them and their families. I think this has turned, for me, the midterms, the headline news were about the House flipping, but the subtext in red states and blue states is that healthcare is popular, it's essential, and we are going to find a way to expand coverage and get people their care they need.
I like that word, subtext, John. That's a good one. That's
It's
kind
complicated
of like
for you. I understand.
Little textual analysis that we'll bring to the party. John, I think people realize, including Republicans who are running for office, that the pre-existing conditions issue is a real one. And what happened was they pretended that they were actually supporting legislation that preserved pre-existing condition coverage, and it didn't. And the public saw
right
through it. Boom, like a laser.
I think we agree again.
All right, well, let's disagree then. That's more fun. So, John, you're involved in home health. You got home health in the head, which is good. Probably
is where the heart is,
Probably
David.
your shareholders care about that since you run
It's the right thing to do.
Business.
More care can and should be done in the home.
But I'll tell you
where
what,
people should age and heal.
No
What
kid.
have you got to get?
All right,
You're the protector and defender of the status quo. Come on.
This is like the whataboutism. Here's the thing, John. A lot happened in healthcare last year, right? As we've been talking about. In the home, not much. Not much happening.
Absolutely
You've just been watching the things go by. Nothing happening in the home.
Absolutely not.
Am I wrong?
You're totally.
Tell me why. I'm waiting to hear.
It's a complicated thing, but this supplemental benefits piece that was tied to an Medicare Advantage is the federal program that brings managed care organizations in, increasingly popular to manage care for the elderly.
Just what we needed, more insurance companies.
Advantage.
Yeah.
And
Medicare.
What they're doing is they're being a lot more creative than the dinosaurs that you're defending by looking at things like access to housing and food and transportation as ways to lower the cost of care by getting people better and getting them meeting more of their needs. They're called the social determinants of health, an ugly phrase.
Socialism
really talks about the whole patient. Ignore the guy to my right. Because what this really is just rationally, someone who's hungry is much more likely to end up in the ER. And if you can't understand that, David, you don't understand what treating a patient as a whole patient is. A patient isn't a transaction, and they're just not a condition. You got to look at all the things that are going on in their life. And if you think about that whole Medicare Advantage supplemental benefits, it's already healthcare on a budget. We have a healthcare system that's now rationally looking at all of the things that we can invest in to bring down healthcare costs.
You know what, John? So that noise that you heard, that was like the knee jerk of John whacking the table from underneath it. John, listen. One problem that we have in this country is a third-party payment system, very inefficient. Okay, it's bad enough that it pays for routine doctor visits and aspirins and that kind of thing.
So now you're against insurance. Now you're for insurance.
You're going to talk about now. It's going to expand and it's going to cover food and it's going to cover housing. That is socialism, John. It is a proven failed experiment.
It actually
yeah.
You can't even understand the whole socialism
you said it was simple.
Versus capitalism. What's simple is if we feed people when they're hungry, they will be healthier. We clothe people who are cold.
All right.
We house people who are homeless. When
and
we
there's
do
a nice
that
Christmas
in a
message,
rational
John, but we're talking
way,
health insurance here.
In a thoughtful way, in an economical way, we will actually bring down the cost of healthcare, which is a tax on every American in that third-party clustered system that you seem to want to defend.
So, John, I don't want to be the Grinch here around Christmas time. So I will say,
kind of are.
The idea, let's say, of it. Well, I don't want to be.
Okay.
Let me try not to be.
Let's try to be ambitious.
So here's the thing. So I agree. Say a diabetic should have food to eat And
Good.
it's cheaper
Clever.
to give them
Clever.
a hamburger or whatever somebody wants to eat compared to
We're just
having
talking
them
about
in the hospital, right?
Access to healthy, affordable food.
But so it sounds good, to do that. But
Yeah.
I don't think it's efficient to do that with insurance for everybody. So I think it's going to be, here's my challenge for you for 2019.
Okay, I'll take it on.
Prove that kind of preventive, feel-good stuff actually adds up in dollars and cents, and you actually save more in aggregate. Not just for that one person who was able to be healthy,
Geisinger
but
Health
broadly.
System brought down hemoglobin A1C, one of the key markers for diabetics, by over 2 points by just giving access to healthy food through their free food pharmacy. That's more effective than most drugs.
I want to see the
How many more facts?
I want to see the 3-point play from you next year, John.
Okay.
Am I being too aggressive?
Yes.
All right. So we want to keep it simple. Let's keep it simple, John. Here's my question: with today's immigration climate, who's going to take care of mom?
Well, it's a real issue. I mean, if you look at urban and rural hospitals, you'll see a lot of doctors and nurses who are direct recent immigrants. Our healthcare system runs on immigrant talent as well as national
America
American
runs on Duncan
talent.
and doctors.
Honestly, America as a country's growth rate is going to be tied to rational immigration policy that supports sensible immigration, which our current policy and noise does not. In fact, I'm afraid even just the noise is going to drive a lot of foreign talent out. But if you actually look at who's going to take care of my 84-year-old mom, and you think about the 1 out of 4 workers who are recent immigrants who are at the bottom of the pyramid of labor, but actually touching patients every day, I'm really concerned. And I think we've got to reverse it, because if we don't, healthcare costs are going to go up, and our vulnerable patients like my 84-year-old mom, will not get access to the care they need, or the cost is going to go through the roof. Neither of those are sensible or rational. We've got a system that works. Let's go back to rational immigration policy. Okay, I want to see you take the other side of that.
So, John, what I'm going to do, I'm going to go bigger here. Okay, I think that
because you can't.
The tax on immigrants are really kind of tearing the country apart, and are really kind of despondent about what to do about it. One possibility to bring people together is to understand Democrat, Republican, right, left. Who is taking care of mom? Who's taking care of grandma? Who's taking care of a child with special needs? Who's filling my prescription, keeping the pharmacy open late? And that's immigrants. And I think healthcare is a way that people can actually see immigrants day to day,
so especially tell the story.
Yeah, especially in some of these.
Yeah, as a positive story.
Especially in some of these rural areas.
So now that we're starting to agree.
Yeah, we got to stop, John. So let's go right to the lightning round so I can strike you. Well, the Grinch stole Christmas, and you stole my sweater.
It's
what
our
the heck?
sweater. I mean, the relevant healthcare point here, David, is that Texas judge who tried to steal the ACA using flawed logic is going to be overturned in the same way that the Grinch couldn't steal Christmas.
Amen, brother.
So, David, the Russians are meddling in the election. They appear to be meddling in social media. What about healthcare?
John, the Russians saw a smooth...
Can I stump you with that?
The Russians saw a smooth functioning democracy and decided, let's get in there and mess it up. When they see healthcare, they say, I don't think it could screw it up any more than it already is. So I think we'll stay back. The Americans seem to have that one pretty well. John, what was the best healthcare moment for you in 2018?
Well, my sister had CF. So I think with the relentless advance of genetic medicine going from targeted genetic medicines to advance life by mitigating conditions is actually extending to actually reversing some of the results of that deadly disease. And I think as you start to think about the progress of leveraging knowledge to actually turn around disease in things like cancer and cystic fibrosis, it's extraordinary.
John, cystic fibrosis is just a devastating illness, and it's wonderful that we have these medications, and I think the cost is appropriately high. And what I'd like to see in 2019 is the best moment, is let's get rid of some of the unnecessary things so that we can afford things like this CF treatment.
We have to. And I think the price, America's willing to pay more if it gets more, but we have to bring down the price of some of those old drugs that just keep going up.
John, I know you're a big New Year's Eve kind of guy. Where are you going to be? Where are you going to be when the ball drops this year?
If my plans hold, I'll be having dinner at a lovely inn in the middle of the winter, and we'll probably be cross country skiing home at that point. How about you?
Well, John, I'm planning to be in front of my computer monitor watching reruns of CareTalk from this fabulous 2018.
I think we can do better.
Well, that's it for this edition of CareTalk, and in fact, for this year of CareTalk. If you like what you heard or what you saw, please subscribe using your favorite service. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.